Next, we will be discussing the post-op diets and how to eat after surgery for optimal healing and recovery.
We do want you to limit high carbohydrate foods during the first 3 months after surgery. What we find is that some of these foods listed below, like bread, pasta, crackers, rice, grains like quinoa, tortillas, wraps, or chips, can get in the way of you meeting your protein needs and your hydration needs. So we really do want you to focus mostly on lean proteins and cooked vegetables and soft fruits for those first 3 months. And then once you're able to get those goals in, you can start to incorporate these high carbohydrate foods in very small amounts.
We're not going to do any raw fruits or vegetables for the first 3 months post-op. Again, too much fiber and it's too crunchy at this point for your stomach.
Your first stage of the diet is going to be diet stage 1, which is your liquid diet. You're going to be on this diet while you're in the hospital and also for the first 48 hours at home after surgery. Your primary goal during this time is to get in enough fluids, okay? We're hoping for you to get in at least 48 to 64 ounces of fluid each day. At first, you can focus on having about an ounce of fluid every 15 minutes or so, and then increase from there as you're able to get in a little bit more liquid in your stomach. This also is going to include the fluids that you get from your protein shakes. So definitely use those to help promote healing and to help you with meeting both your fluid and your protein goals. So what do we want you to drink during this stage? Well, of course, we want you to have protein shakes, so definitely have those. But we want you to really focus on getting in fluids that are sugar-free, caffeine-free, and non-carbonated, okay? We want to avoid carbonation because carbonation can feel really uncomfortable in that tiny stomach, and so we want you to stay away from that. We do want you to avoid caffeine for those first 3 months after surgery. Why is that? Well, we find that caffeinated beverages tend to be very irritating on that new stomach and can cause a little bit of reflux. So we want to make sure you're staying away from that. The other thing is that we don't want you having something that's going to cause more dehydration, and caffeine can do that a little bit. So we want to make sure that you're focusing on things that are caffeine free. Now you'll see down here that you can have decaf coffee or decaf tea. That's totally fine, but we don't want you to have more than a cup or two a day. And we also want to make sure that you don't put anything too high calorie in your decaf coffee or tea. So really try to avoid any heavy creamers or anything that has a lot of sugar. And of course, we want to stay away from beverages that have a lot of liquid calories. So these would be highly sweetened beverages with added sugars, fruit juices, things like that. So you can see down here we have a lot of great examples of appropriate fluids that you can have. We often recommend that our patients try calorie-free flavored beverages because these tend to sit better in your stomach than just plain flat water. So try some of these out. Try to have some that you enjoy in your stock so that you can use them if you need them. The other thing that we want to keep in mind is that if you are really struggling with your fluid intake and you are not able to get in enough, if you can't get in at least 32 fluid ounces for 2 consecutive days, then we need you to give our office a call and talk to one of our nurses. We want to evaluate you to make sure that you're not dehydrated, and if you are dehydrated, then we might have you come in to get some IV fluids. But again, just monitor your intake and make sure you call us if you're really struggling. Next, you're going to move into diet stage 2. This will be the first 2 weeks after surgery, and you're not going to advance your diet to stage 2 until you've been successful with getting in your 64 ounces of fluids and up to 60 grams of protein through your protein shakes, okay? Once you feel comfortable doing this, then you can start to add in some of these blended and smooth foods. These are foods that are going to be very highly concentrated in protein and are going to help you with hitting those protein goals outside of just your protein shakes. We're still focusing on 64 ounces of fluids a day, and we're hoping to get up to 60 to 70 grams of protein a day. Really make sure that the foods that you're choosing are smooth. We don't want your stomach to have to do a lot of work, and if you're swallowing things that are not chewed well, your stomach is going to want to churn and try to masticate that up, and it's not going to feel good. So by the time that you swallow something, you want it to be nice and smooth. Now, this doesn't mean you have to throw everything in a blender, but you need to really pretend that your mouth is a blender so that you can really make that food nice and smooth. Moisture is also very important too. So make sure that you are focusing on the foods below, things like Greek yogurt, cottage cheese, pureed beans like refried beans. These are all great ways to get in some good protein. You can also add unflavored protein powder to some of these foods to help boost up their protein intake. So I've had a lot of people that will take something like a low-fat cream soup and they'll add unflavored protein powder to it to really give it some extra boost. So that's something you can definitely try. And your portion size at this point is going to be up to about a 1/4 cup. So try to stay within that portion size. So now you're going to move into stage 3, which is your mashed foods. And you're going to start stage 3 at week 3, right? That should be pretty easy for you to remember. You're still doing 64 ounces of fluids and 60 to 70 grams of protein, but now we're going to start to add in some real solid foods here. You can do canned tuna, canned chicken, soft scrambled or poached eggs, deli turkey or ham, really soft flaky fish, ground chicken, ground turkey, as long as it's more than 93% lean. And moist chicken that can be pulled apart pretty easily. Some people like to do rotisserie chicken, but we like to focus mostly on the breast meat at first. You could do tofu, still more low-fat cheeses. These are all great ways for you to start experimenting with more solid food. I think the most important thing to focus on at this point is that whatever moist protein you're going to have, it needs to be very moist. It needs to be cooked in a way that is going to retain that moisture and make it nice and juicy. So first off, don't overcook things and use moist cooking methods. So things like baking or roasting, poaching, doing pulled chicken in the crock pot or the Instant Pot. These are all great ways to keep your proteins nice and moist. The other thing that you're going to want to start doing during stage 3 is starting to incorporate some cooked vegetables and soft fruits. These are perfectly fine to start having at this point. You just want to make sure that they're soft enough that you could mush them down pretty easily with a fork. So start to incorporate those things. You always want to make sure that you eat your protein first. So get that protein in, maybe up to a 1/4 or a 1/3 of a cup, and then see if you can get in a spoonful of some really soft mashed green beans or maybe some mashed cauliflower. That would be a great way to start adding in some good fiber to your diet as well. Next, you're going to move into diet stage 4, which is your solid foods. And this diet is pretty similar to stage 3, except you're adding in a little bit more variety with the types of proteins that you can get in. So we're still doing 64 ounces of fluids and 60 to 70 grams of protein, but we're going to slowly add in a little bit more normal textures with your eating. Again, continue to keep things moist as best as you can, and remember that there are going to be some foods that just might not go down well. And, keep notes of those foods. Really start to pay attention if something is bothering you. So some of the things that you can add in at this point are going to be more solid chicken breast, turkey breast, lean beef, Make sure it's nice and lean. So having leaner cuts like sirloin are going to be better than having, fattier cuts like prime rib or something like that. You can certainly do Canadian bacon, different types of fish, lobster, scallops, shrimp. Of course, we're not frying any of these things. We're focusing on low-fat cooking methods like baking, roasting, grilling, etc. And you can really start to expand that protein intake. Veggie burgers are another really great way to add in protein to your diet. Just make sure that your veggie burger has at least 10 grams of protein. We really want to focus on the ones that have more protein versus ones that are less protein and maybe higher in carbohydrates. You're going to be getting in close to about a half a cup per meal for your protein, and then maybe a little bit more with whatever vegetable you're adding in. At this point, you're still doing all cooked or soft fruits and vegetables, okay? So we're gonna continue to stay away from raw fruits and veggies until we get past 12 weeks post-op. So now we move into stage 5, which is your final stage of the diet. This is your diet that you're gonna be following for the next forever, the rest of your life, right? So after 12 weeks post-op, this is when things change a little bit. Of course, you're still focusing on your 64 ounces of fluids, maybe even more if you can get in that. Our protein goal is going to be a little bit higher now. You can go up to 60 to 80 grams of protein a day. I tend to recommend that patients don't go over 100 grams of protein a day. But again, this is something that you can discuss with your dietitian individually as you progress through your post-op journey. Your maximum portion size at this point is going to be about a cup to a cup and a half per meal, right? And we'll talk on the next slide about what makes up that cup or cup and a half. This is when you can start to incorporate raw fruits and vegetables. You can also start to incorporate whole grain carbohydrates, okay? The biggest thing though here is that you always want to eat your protein first, no matter what. Every meal, every snack should always have a high quality protein source. And we want to make sure that you always have that first at your meal. Make sure you try to get in as much as you can before you start filling up on your fruits and veggies or your carbohydrates. So here we've created what we call our bariatric plate method. We like this image because it does a good job depicting how your food should be proportioned on your plate. I like it because it's flexible. Okay, you can use this if you're out at a restaurant, if you're at a friend's house, and really just if you focus on this proportion of nutrients, you'll be going in the right direction in terms of your nutrition goals. So you'll see here that we start at the lean protein part of the plate, right? We're always talking about eating protein first. So you're gonna start here and you're gonna try to get in anywhere between 2 to 4 ounces. You know, this is gonna change as you get further and further out from surgery, but try to get in that 2 to 4 ounces and then move on from there. So then you're gonna go over to your vegetable and your fruit side, and you're gonna try to get in as many non-starchy vegetables or fruits that you can, right? We wanna really make sure we're getting in lots of fiber in our diet and that we're trying to prioritize that over maybe your carbohydrates, at least for the time being. And then the next thing you're gonna move into would be that grain section. So you're really only going to consume these grains if you have room in your stomach after you've already had your protein and your vegetable and your fruit, okay? If you do have room for that carbohydrate, make sure it's whole grain, make sure it's high fiber. That's really what we want to focus on, are these complex carbohydrates. So whole wheat bread, high fiber tortillas and wraps, grains like quinoa, barley, wheat berries. These are the types of things we want you focusing on. We do want you to keep that portion size to no more than 1/3 of a cup cooked, okay? So this will give you some guidelines in terms of how much you need, and you can use this throughout the rest of your post-op experience to really help guide you in what you should be consuming at your meals on a day-to-day basis. So now let's talk about your menu assignments. We want to know that you understand these diets, and so we'd like you to do a little bit of homework for us. At your next dietitian visit, we would like to see you have 5 completed menus of what you're going to eat after surgery. So we want you to go through and we want you to look at what you can eat on each stage of the diet, and we want you to create a menu of what you think you are going to consume, foods that you enjoy, things that you feel are going to be good for your palate and are going to help you meet your protein goals. So in the education website in the Eating for Life module, there should be a place to download some blank menu assignments for you to fill that out. You can also find these menu pages in the back of your Eating for Life handbook. We want you to complete this any way that you can. So if that means writing it down in your handbook and then bringing it to your next appointment with your dietitian and showing it to us in person, that would be wonderful. If you'd like to download the PDF and fill it out there, you can certainly send it to us through MyChart. You can attach things in MyChart, so that would be a great way to send it. Or if you have your dietitian's individual email, then you can do it that way as well. But again, we're looking for you to complete the menu assignment so that we can see that you understand the types of foods that you're going to be having on each of these stages of the diet, and that you understand what you're going to need to do in order to meet your fluid and your protein goals. So as you can see here, this is a great example of someone filling out their menu assignment for stage 2. So you can see that they are including stage 2 foods like cottage cheese and Greek yogurt, protein shakes, decaf tea, and they're writing down the fluid amount that they're having around that time. And then they're also writing down the protein intake as well as their vitamins that they're going to include. So this is what we want you to do for menu stages 1, 2, 3, 4, and 5.
So now it's time to complete your learning module quiz. Make sure you go in and you complete the quiz. Your dietitian will check to see if that's been completed. And if you have any questions at all, please reach out and get a hold of one of the dietitians here. Thanks, and hope you have a good day.